Autonomic rebalancing theory is an outdated, oversimplified framework that incorrectly elevates color to a therapeutic variable while ignoring the actual complexity of light effects on the brain. And so welcome back. Let's continue my discussion with the two AI engines, ChatGPT and DeepSeek, regarding Syntonics. This time we're going to talk about this idea of ANS, or autonomic nervous system rebalancing, and this concept is critical or central to the practice of Syntonics and the rationale for treatment. And so let's have a look at this, and I asked two questions and I'm just going to combine them in the responses, and the questions are as follows. So first of all, in the world of Syntonic Phototherapy, what is meant by sympathetic balance? And secondarily, it seems to me that the notion of sympathetic balance has no veracity at all in medicine, given the autonomic nervous system is always in a state of flux and adjustment, and given that there is no way to show the metrics mentioned have anything to do with sympathetic tone. For example, small or large pupils can be accounted for in myriad ways, likewise body somatotype. And so very briefly, let's have a quick backgrounder once again on the autonomic nervous system, the ANS. And so the ANS has two primary divisions. The sympathetic fight or flight division activates arousal, vigilance, energy mobilization. It's associated with dilation of the pupils, increased heart rate, reduced digestion, heightened stress reactivity. And so the parasympathetic, for its part, is always in opposition to that. It doesn't just turn on every now and then. These things are in constant flux back and forth. The parasympathetic division is more the rest and digest portion of the puzzle here. It calms and restores, lowers arousal, supports healing and digestion, associated with pupillary constriction, in some contexts, and slower pulse and relaxation. And so a brief discussion on this notion of ANS balancing. And so for healthy functioning, a dynamic balance between these systems is required. Neither dominance nor suppression of one side. Thankfully, the body has many mechanisms at play to achieve this balance. So it's an excellent question. This idea of sympathetic balance is a central idea in Spittler's Syntonic Phototherapy framework, and it connects directly to his use of color light filters, autonomic physiology, and the notion of restoring health through the visual system. You're making a very fair critique, one that reflects why mainstream medicine and neuroscience never adopted Spittler's framework. Let me unpack this in relation to your points. So first of all, sympathetic balance, as Spittler described, has no veracity in modern medical terms. The ANS is far too dynamic to be reduced to a static imbalance, and his chosen markers, pupil size, somatotype, field constriction, are non-specific. That said, his intuition that light can shift physiological states via the eyes wasn't wrong. It's just that the mechanism are circadian, hormonal, and cortical, not the simplistic sympathetic parasympathetic model he proposed. Now, the notion of sympathetic balance in Syntonic phototherapy. In Spittler's terminology, sympathetic balance meant restoring equilibrium between sympathetic and parasympathetic nervous activity, using colored light through the eyes. If a patient was sympathetic dominant, the signs would be anxiety, tension, over-arousal, narrowed visual fields. And the treatment would be inhibitory filters, cool colors, for example, blue, blue-green, to reduce sympathetic overdrive. If a patient was sympathetic dominant, the signs would be fatigue, lethargy, poor alertness, wide or unstable visual fields. A treatment stimulatory fields like warm colors, for example red and yellow, to activate sympathetic tone. Sympathetic balance was achieved when the patient's visual fields opened, pupils stabilized, and systemic signs improved, indicating that the autonomic nervous system was more harmonized. And so one of the critical problems with this proposition is that the ANS is dynamic, it's not static. You don't sit in one state of function and then switch to another state of function. It's in constant flux. And so modern neurophysiology sees the ANS as a constantly adapting network modulated by context, environment, and internal states. It isn't meaningful to talk about a person being sympathetic dominant or parasympathetic dominant as a fixed constitutional trait. At best, we can talk about patterns of reactivity, so chronic stress leading to altered heart rate variability, HRV, vagal withdrawal, and others. But these are measurable, time-varying dynamics, not static categories. Next, these clinical indicators of balance are somewhat problematic. And so let's look at some of these indicators of sympathetic balance. And so practitioners use several indicators to judge whether sympathetic balance was restored. Visual fields, for example, these are very important. The perimetry changes before and after light exposure are taken into account, and these just don't happen in nature. We can look at also pupillary reflexes, looking for more stable reactions. Still, these are highly variable and rarely quantified by the clinicians who observe them. Subjective changes, reduced anxiety, better focus, clearer vision, improved energy, again, relying on subjective measures. And so let's look at the modern view. Today, in neurooptometry, the language of sympathetic balance has shifted more towards autonomic regulation and neuroplasticity. While mainstream science is skeptical about the efficacy of Syntonics, the idea of balancing sympathetic and parasympathetic tone overlaps with other better documented fields like HRV biofeedback, vagal tone modulation, and stress physiology. Regarding Spittler's sympathetic balance, it's best to be viewed as proto-theory. Spittler borrowed from early biotypology and constitutional medicine, now obsolete, to argue that physical features like somatotype, pupil size, and visual fields reflected a person's autonomic set point. Today we know that pupil size depends on multiple influences, including light intensity, cognitive load, drugs, fatigue, emotions, not just sympathetic or parasympathetic tone. Next, somatotype has no validated correlation with autonomic physiology. Finally, visual fields can vary due to neurological, ophthalmological, and even attentional factors, again, not a direct proxy for ANS state. In other words, his diagnostic metrics lack specificity and causal validity. Now, there's the problem of measurement. Modern medicine measures autonomic activity with heart rate variability, HRV, skin conductance, baroreflex sensitivity, and sometimes direct microneurography. Spittler's framework predates these methods, and so he relied on observational proxies, which seem crude or nonspecific by today's standards. Again, pupil responses, for example, were never quantified, only described. Why do his ideas persist? Even though his model is outdated, it resonated clinically with some patients and practitioners, partly due to the placebo effect, partly because color and light exposure can influence mood, alertness, and circadian rhythms. The kernel of truth here, that light does affect physiology, allowed Syntonic Phototherapy to survive, even though its theoretical scaffolding, the sympathetic balance, the somatotypes, and pupillary signs, doesn't hold up scientifically. Now, regarding the claimed rebalancing of autonomic tone, this is the theoretical heart of Syntonics, and also its most scientifically fragile claim. Spittler proposed that specific colors act on the hypothalamus to balance sympathetic and parasympathetic outflow, thereby improving ocular and systemic health. The neuroanatomical reality is somewhat different. The autonomic nervous system is not a simple seesaw of balance that can be tuned by isolated retinal light exposure. It is a complex distributed system with a central autonomic network. So the insular cortex, the anterior cingulate, the amygdala, the hypothalamus, the brainstem. And we have reciprocal and non-reciprocal interactions between sympathetic and parasympathetic branches. We have a context-dependent homeostatic regulation, not a fixed set point. So what does light actually do to autonomic function? This is the nugget of truth that gets overinterpreted. It's an established fact that bright light, particularly blue-enriched light, activates the intrinsically photosensitive retinal ganglion cells, and these project to the suprachiasmatic nucleus, the circadian clock, the olivary pretectal nucleus, the pupil light reflex, and indirectly to autonomic centers. So the real effects of bright light, the acute effects, are increased alertness, increased heart rate, pupil constriction, and suppression of melatonin. The chronic effects include phase shifting of circadian rhythms, changes in sleep-wake patterns, seasonal mood effects. There are measurable autonomic changes, such as heart rate variability or HRV, that can shift transiently with bright light exposure. Dim red light has minimal effect. Bright blue-white light has measurable effects. Now, the Syntonic misinterpretation here. The leap from these established facts to Syntonic theory involves several unjustified steps. And I'll put up a table here, and you can pause here, and you can study these. I'll move on to save you some time. Let's look at some of the critical scientific problems here. First of all, there's a lack of specificity. If Syntonics truly rebalanced autonomic tone, we would expect a dose-response relationship, more light, more effect. A wavelength specificity. It should be reproducible with predictable effects of each color across individuals. There should be physiological correlates. consistent changes in HRV, pupil dynamics, skin conductance, or salivary biomarkers. There should be clinical specificity. Different autonomic conditions, for example, sympathetic excess versus parasympathetic excess, would require different colors. None of these have been demonstrated in rigorous peer-reviewed masked trials. What exists instead are small uncontrolled case series, no dose response data, high inter-individual variability, no correlation between autonomic measures and clinical outcomes. Then there's the placebo confound. Autonomic tone is highly susceptible to expectation and relaxation. A patient lying quietly in a dim room for 15 minutes with a soothing colored light, receiving attention from a caring clinician, will almost certainly show reduced heart rate, somewhat increased heart rate variability, that's a parasympathetic shift, reduced skin conductance, subjective calmness. These are non-specific effects of rest, relaxation, and therapeutic ritual. They occur in any low arousal, attentive intervention, regardless of color. A proper control would use equal luminance white light or inactive color, one not claimed to affect that specific condition, under identical conditions. Without that, any observed autonomic shift cannot be attributed to wavelength. Now, let's look at the clinical bottom line for autonomic rebalancing. Does Syntonic claim on the one hand that specific colors rebalance sympathetic parasympathetic tone? Established science tells us that light intensity and timing affect circadian rhythm and autonomic function via IP-RGCs, not via color-specific balancing. Syntonic claim that color is the critical therapeutic variable, whereas science tells us that luminance, duration, timing, and individual circadian phase are likely more important. According to the Syntonic principle, there's lasting autonomic change that occurs. Established science tells us that most light effects are acute or circadian phase shifting, not lasting or rebalancing. The Syntonic principle tells us that clinical improvement is due to autonomic change, whereas science tells us that improvement is better explained by non-specific relaxation, placebo, and regression to the mean. And the final verdict here, that autonomic rebalancing theory is an outdated, oversimplified framework that incorrectly elevates color to a therapeutic variable while ignoring the actual complexity of light effects on the brain. Let's do a final clinical analysis of what we've seen so far. In Syntonic Phototherapy, sympathetic balance refers to the therapeutic goal of equalizing the sympathetic and parasympathetic branches of the autonomic nervous system through retinal stimulation with colored light. Too much sympathetic activity, so stress and tension, or too much parasympathetic activity like sluggishness and depression, were seen as pathological. Syntonics sought to normalize this balance. Syntonics may produce observable short-term changes in some patients, but these are adequately explained by non-specific effects: relaxation, reduced test anxiety, learning on repeated measures, transient post-illumination physiology, and placebo. The specific claims of visual field expansion, durable accommodation and vergence improvement, and autonomic rebalancing lack neuroanatomical plausibility and rigorous clinical support. Until sham-controlled and masked trials demonstrate effects beyond these confounds, I cannot recommend Syntonics as an evidence-based therapy. And I agree with that. This is not dogmatic skepticism, it's applied clinical science. It is possible for Syntonics to prove its worth clinically. To do that, it needs to accept current applications of PBM and light therapy and their mechanisms, and use this knowledge to pursue formal scientific inquiry to show support for the claims Syntonics makes, and develop standards for testing, interpretation, and research. If there is a benefit to Syntonics, it is in the interests of clinicians and clients to investigate more rigorously according to known clinical science standards. Until then, Syntonics should be considered nothing more than cool tea on a hot day. Thanks for listening, and I hope you learned something about science and Syntonics, and I look forward to seeing you in the next piece in this series.